We presented the retrospective data on 156 patients that received BCMA CAR T. We had both products, ide-cel and cilta-cel. And what we looked at was this early period, the first 15 days after infusion, and the dynamics of the absolute lymphocyte count as measured in just a routine CBC. We noticed that some of our patients had very prominent increases around day 10, and this poster started from a clinical observation. And what we noticed was this: it's not only a very common phenomena, but there's also difference from product to product. So patients with cilta-cel tend to have a more prominent expansion around day 10 or 12, whereas those with ide-cel, it's a little bit earlier, but a little bit less pronounced. Other than a very interesting clinical observation, I think the most important is that this ALC increase correlates with CAR T expansion when we check the by flow. And more importantly, patients who have more prominent ALC expansion have actually better outcomes. So we noticed that those with an ALC above 1, for example, had a median PFS of over 33 months, whereas those with less than 0.5, the median PFS was somewhere less than 6 months. So not only this is a very actionable prognostic value, but also it's very applicable to the clinical practice. Importantly, the ALC remains significant after adjusting for other important prognostic variables such as high-risk cytogenetics, extramedullary disease, number of lines of treatment. Importantly, we couldn't really find any other factors that influence these ALC changes other than the presence of CRS and ICANS that is probably related to the CAR T expansion. But we also noticed that those who received cytotoxic chemotherapy, especially bendamustine as the prior line of therapy, they actually had less ALC expansion. So I think it's a very interesting observation. It's a very accessible biomarker that can tell us in the first 15 days after treatment what can we expect from the BCMA CAR T response in terms of depth of response, but also PFS.